Robbin Miller, host of Miller Chat. My guest today is Colin Killick, Executive Director of the Disability Policy Consortium in Boston, Massachusetts. Welcome to my show.
Thank you so much for having me. It's a pleasure to be on and getting to speak with you today.
It's interesting how we planned this last fall in September, and here we are 6 months later.
Certainly, a lot has gone on in that time period.
Yes, yes. So I'm glad that you came on, and I wanted you to just tell the viewers a little bit about yourself and the organization that you run.
Yeah, absolutely. So the organization is Disability Policy Consortium.
Mm-hmm.
We are a statewide disability civil rights advocacy and research organization. We're based in Boston, but we work statewide. I actually have spent some time in Shrewsbury. Um, and we have around 25 employees. 75% of them, myself included, have disabilities of one kind or another. Um, we work to make the state more accessible and inclusive for people with disabilities in a fairly wide variety of ways. So we have various bills before the state legislature, which I can certainly get into. We also
Mm-hmm.
work with state agencies on a regular basis, um, particularly Mass Health. We're in pretty constant dialogue with around policies and expressing
Mm-hmm.
the concerns of the disability community, but also I'm an advisor to the Health Policy Commission. We're going to be involved in the governor's new housing plan. We've done work around the MBT accessibility on the MBTA in the past, kind of you name it. Um, we also conduct research with a variety of partners, including Brandeis and the Institute for Community Inclusion at UMass Boston, and others on issues from how opiates impact the disability community to the importance of peer supports to
Mm-hmm.
a project we're actually the lead research organization on that's going to be happening in the Springfield area, looking at racial and linguistic barriers to accessing home and community-based services like personal care attendants and what the ramifications of those are. We have a new program that does disability-focused DEI, diversity, equity, inclusion trainings
Mm-hmm.
for employers, as well as providing HR, inclusion consulting, and subject matter expertise. And we operate a program called My Ombudsman, which is a free service available to all Mass Health enrollees,
Mm-hmm.
where if they say are denied a service or they have questions about what benefits they're eligible about, or they have a dispute to resolve with the plan or a provider, we are an independent third party who can work to mediate those issues and get people access to the care they need.
You do a lot.
We do. As I was saying to someone earlier today, because people with disabilities are present in all communities, all issues are disability issues ultimately.
Mhm.
So we have to have a pretty broad range.
I remember working for an independent living center in Worcester from 1996 to 2002, and it just ran the gamut on the different types of issues. And I went from independent living specialist to advocacy coordinator. Some of the issues that you're going to be talking about, I remember working on similar issues. Here we are 20 years later. So
Yeah,
actually, my show Miller Chat was 1999, and it was based on talking about different disability issues.
that's great. Well, nice to have such a long tenured program highlighting the perspectives and the needs of our community.
So I remember your organization as having Bill Allen and Mary Mahoney.
Yeah.
And is that when the DPC came about?
Yes, they were involved right from the beginning. So the organization started in '96. Also, folks like John Chappell were involved in the early stages. Charlie
Hmm.
Carr, who's Charlie's actually still on our staff. Um, Initially, around there was a proposal by then I think it's Secretary of Health and Human Services at the time, Charlie Baker, long before he became governor,
Mm-hmm.
to consolidate all of the state disability agencies into one mega agency, which would have resulted in less overall funding for disability
Hmm.
organizations and the loss of a bunch of roles. And often those agencies, people who worked for them were the only prominent people with disabilities within state government. And a lot of those, those advocates, those voices, would have no longer been there. So a
Right.
bunch of people with a bunch of different disabilities came together, met at the state archives, created this group, Disability Policy Consortium, to fight successfully against that proposal and preserve these as separate agencies. And
Hmm.
in the aftermath, decided to keep working together. So, yeah, started way back then. but we've grown hugely since then. When
Yep.
I came to work at DPC in 2014. John Winsky
Okay.
was the executive
Yes,
director
I know
then. He
him.
was
I know him.
my immediate predecessor and mentor. But yeah, when I started, I think there were 6 employees,
Hmm.
and now I think more than 20. Actually, I think we're 27 or 28 now. So it's and a budget of over $2 million. So it's really expanded quite a bit. We've been able to
Wow.
have greater reach and impact in the community. But yeah, folks like Bill Allen and Mary Lou are still voices in our work. I still talk with them, and we have awards named after the both of them actually
Hmm.
for people that we give out every year for folks who have had particularly significant impacts on behalf of the disability community.
Yep. They were very good leaders in the advocacy field.
Absolutely, I've learned a great deal from both of them.
Yeah. So, let's talk about some of the key issues that your organization is working on. So, which one would you like to talk about first?
So actually, before getting into the legislation, there's one matter that's particularly urgent. The state budget process is kicking off.
Okay.
For folks who may not be familiar, the budget happens every year, and usually around initially the governor puts forward a proposed budget, which is sort of a wish list, what in this case she'd like to see, and then each house, first the House and then the Senate put together their own budgets, and then those House and Senate versions are reconciled through a
Hmm.
process called the conference committee. So right now, the governor has put out her budget, and the House is working on its budget. And our community has some serious concerns, and as do I think a lot of folks. In response to apparent revenue shortfalls, the governor's budget calls for a bunch of cuts to certain key
Oh.
services, including certain HIV
Hmm.
services, which we certainly are strongly opposed to cutting those. The biggest impact on the disability community is arguably that the budget calls for large scale cuts to mass health. And one of the ways they want to
Mm.
accomplish that is by cutting over $100 million out of the personal care attendant program
Oh.
by both reducing meal prep hours for everyone in the program from 13 hours a week to 7 hours a week, so only 1 hour a day of assistance with meals, which for folks who have complex diets or whatnot is really not a lot.
Right.
But even more concerningly, secondly, they propose restricting eligibility for the program to so that you would have to have at least 10 hours per week of assessed activities of daily living ADL need. And I know
Okay.
this sounds sort of technical, but activities of daily living are the basic, washing, dressing, eating, going to the bathroom, transferring in and out of bed, that kind of thing, which is certainly a lot of what PCAs do. But there's a whole other category of what are called IADLs, which are things like, cooking, laundry, help
Right.
like dealing with household finances and organization and, cueing and prompting, reminding
Hmm.
people, need to move from one thing to another, which are disproportionately used by people with intellectual and developmental disabilities. And those aren't being taken into account for that, right? Those folks, if no matter how great their level of these IADL needs are, if they're judged to not have enough ADL need, they would no longer be eligible for the PCA program. Now,
Right.
Mass Health has said that they could get services through other things like the adult foster care program instead, or the home health
Hmm.
benefit, but those are more restrictive in who can be on them. Adult foster care, for instance, requires that you have a live-in friend or family member, not who can't be a parent um, or a spouse who's willing to provide those services. And home health both doesn't offer as wide a suite of benefits, and most home health agencies have waiting lists.
That's
And
right.
aside from both of those programs don't have anywhere near the level of consumer control, independent self-determination that the PCA program does. So we're very concerned, and we're calling on people to call the governor's office and contact their legislators and say that they do not want to see any PCA cuts.
Well, yeah, I know on top of the 9C cuts, it's a shame that they always have to pick uh, communities or populations that really need the services to be independent in their homes.
Exactly. Yeah. And they say budgets are moral documents, right? And I think that, last year the state saw huge tax cuts. And, I don't, we're not going to take a position on tax cuts overall being good or bad, but certainly I think if you have to prioritize tax cuts or critical services for people with complex disabilities, our position is certainly that the latter is a better use of money. A more just use, certainly.
Right.
So that's a big area for us. But we also do have some key bills before the legislature this session. I could just touch on a couple.
Sure.
One of them, so it's changed numbers a few times as it's moved through the legislature. It's currently S 2546,
Hmm.
so Senate Bill 2546, which is an act expanding wheelchair warranty protections for customers with disabilities. And this is one really critical, and it's a problem that's been sort of festering for a long time, wherein for a lot of people who are wheelchair users, especially power wheelchair users,
Hmm.
it is incredibly difficult and slow to get access to wheelchair repairs. And that is because the power wheelchair industry is essentially a duopoly. Only two companies make up the vast majority of
Wow.
that market. And if you have a chair from one of these companies, you by and large have to get it repaired by them under the terms of your warranty. And we strongly believe that those companies have not done a good job of providing those repairs in a sufficient and timely manner. People sometimes wind up waiting months for
Wow.
repair, and in the meantime, they're effectively stuck in their houses. And there isn't a strong profit motive for those companies to repair wheelchairs because by and large they make money selling new chairs and lose money repairing old ones, or at least that's
Ah.
our belief. The data is somewhat hard to come by, but it certainly is reflected in the fact that um, the warranty protections aren't strong enough. Chairs are too slow to get fixed. People aren't provided with loaner chairs in the meantime often enough.
Mm.
And so this bill, and we've gotten some really good press on this, fortunately, would address all of this. It would put stricter timelines in place for how long chairs could
Right.
be repaired. It would make it more possible for people to get repairs quickly. It would require loaner chairs in the meanwhile. And this would happen. This has happening alongside work we've been doing with Mass Health over the last couple of years to get more flexibilities on that side, more
Hmm.
options for repair, that kind, including a
Of course.
community repair pilot that we hope is coming soon. So that bill, and again, it's S 2546, has passed the state Senate already. It's currently before the House, before the Committee on Healthcare Financing. We anticipate it would then go to House Ways and Means. But I would say if I would encourage any of your viewers to call their state representatives, especially if they sit on either of those committees. Um, and which I know that there are a few who are at least from that part of Central Mass, and encourage them to support that bill moving forward. It's high time for it. Um, so
I think
that's
it's
one of them.
important.
Yeah.
Yeah, I think it's important. I remember Corey Nelson way back, an advocate, died in 2002. I remember how he had to call Senator Chandler for help, for advocacy to get his wheelchair fixed, among other things. So it's been going on a very long time, this problem in fixing wheelchairs and power chairs.
Yeah, exactly. This is not a new problem, but folks are increasingly getting fed up, and this has been really a grassroots campaign over the last few years, stemming from, hearing as just we do regular forums along with Boston Center for Independent Living on healthcare issues facing people with
Hmm.
disabilities. We were hearing more and more about problems with wheelchair repair. Heard from one community member that she'd been waiting months just to get a seat belt repaired on her chair, and every time she went down a steep hill, she was worried she was going to fall
Well,
out. So we've been working hard on that.
oh, and then what other? And you want to talk about another one? What's the other one that you would like to share?
Yeah, absolutely. So this is sort of personal for me. It's a bill that I drafted, and this is S 753, an act relative to preventing discrimination against persons with disabilities and the provision of healthcare. We tend to refer to it as the Healthcare Non-Discrimination Bill, as shorthand. And this really came about. The issues that it addresses existed long before COVID, but they really came to a head during the
Mm.
pandemic. And this is
mhm,
medical bias against people with disabilities, and specifically the belief that is unfortunately common in among certain physicians that life with a disability is inherently less worth living, and therefore the
mhm,
lives of people with disabilities are less worth saving
mhm.
compared to those who do not have disabilities. And we saw this reflected in official state policy during the pandemic
I
in
remember
the
that.
crisis standards of care, right? This was rationing guidelines for
Yep.
ventilators and ICU beds. So we led the ultimately successful fight to get those standards overturned by arguing that they violated the ADA and then other federal anti-discrimination laws. Ultimately, the state pulled the standards, and I served on the committee that wrote the third and final version of the standards, which had that discriminatory language taken out. But in working on this issue at the height of COVID, we discovered that the problems went much deeper than just those crisis standards. Um, both, for instance, in terms of individual providers discriminating. Um, there was the infamous Michael Hickson case in Texas where a quadriplegic man was taken off of life support over the objections of his wife, apparently because his doctor felt that his quality of life was too low to warrant being kept alive. And that those
Wow.
attitudes are right, and they're pervasive,
Mm.
unfortunately. Dr. Lisa Iazzoni, who's the former head of the Mongan Institute for Health Policy at MGH, um, uh, did some groundbreaking research that came out, I believe, in either 2021 and 2022, that around 80% of physicians surveyed in this study said that they believed that people with disabilities did not have as high a quality of life as those who
Mhm.
do not have disabilities. And that plays out in healthcare decisions, right?
Yep.
I mean,
I
there's
know
several
that.
studies.
That's true.
Yeah. So this bill would, in addition to making sure future crisis standards of care wouldn't discriminate against people with disabilities, it says that you cannot deny or deprioritize an individual for care based on the presumption that their life is less worth living due to a
Mhm.
disability. Um, it also says that the state can't use uh, cost effectiveness standards, cost effectiveness metrics, which devalue the life extending
Ah,
effects of healthcare treatments based on
terrible.
disability. This is things like the quality adjusted life year that work that way. Um, and we've done a lot of work around that, and and finding compromises with some cost effectiveness advocates to get that through. And then lastly, this is one I wouldn't be surprised if folks who watch the show may have dealt with. And if they have, we would love to, on any of these, we depend on personal stories. So if you have a story about any of these issues, you can get in touch with us. Our website's at dpcma.org. You can email
Hmm.
advocacy@dpcma.org to reach our advocacy team. But the last provision of the bill is around do not resuscitate orders and other advanced directives, because we've uncovered a number of instances of disabled patients being pressured to sign do not resuscitate orders,
Oh,
again, out of the same belief. Either being,
mm.
they or their family members being browbeaten, said, that they were
Yes.
being selfish, wanting to keep their disabled family members alive, or being told that certain kinds of treatment would not be provided
Oh,
until the person agreed to sign a DNR, which we think is appalling. And so this bill would, borrowing from language that became law in Oregon, would explicitly prohibit um, denying care to a patient because they don't have a DNR, or even implying to family members that they would need to have a DNR before getting treatment. This is not to say that there's anything inherently wrong with do not resuscitate orders, so long as that legitimately reflects the wishes of the patient. But you know, the rhetoric around end of life choice needs to be an actual choice and not presume that the correct answer from a disabled person is no, I don't want to be kept alive.
mhm. Well, in my death and dying classes, when I was teaching that for undergrads, I talked about that, about who decides the quality of life. Society should have decided. The individual decides how they want to live their life. Shouldn't be dictated by the healthcare.
Exactly. And it's striking how wide the divide can be. There was another study, this was back in the 1990s, but I think unfortunately these attitudes haven't necessarily changed that much. But it was asked two cohorts of people. One was a set of people who'd had spinal cord injuries resulting in paralysis, and a set of emergency room physicians. And the people with the disabilities, who had been paralyzed, were asked, "Are you glad to be alive despite being paralyzed? Are you glad to have survived your injury?" And more than 90% said yes. And then they asked the group of those physicians, "Would you want to survive a spinal cord injury that resulted in paralysis?" And fewer than 20% said yes. And those same physicians who said that they wouldn't want to survive such an injury were also disproportionately likely to say that they thought that measures to keep people alive after spinal cord injury were too aggressive, and that someone's future quality of life should be a determining factor in deciding whether or not to keep them alive or to resuscitate them. And so this kind of bias has real consequence. And to some extent, this is going to ultimately require cultural change. And that's why we're doing work around this of disability DEI training. But in the meanwhile, we need strong legislation
Hmm.
that would protect this community. So this was first introduced last session, and it was voted out of Healthcare Financing Committee, but didn't get any further before the end of the session. It's before that same committee again. We're hopeful that it will be soon voted out on the Senate side, but it's going to need people pushing, again, contacting their legislators, writing letters to the editor, et cetera, making it clear that this is something they care about if we want to pass this bill before the end of the session in July.
Wow. I hear you on that one. Yeah, it's interesting when I was working with people with disabilities field, we always said that hospitals, nursing homes are never prepared for emergencies. Never. They never listen to people with disabilities about what they can do to help prepare for a pandemic, an epidemic, and then COVID happened, and then everything fell apart.
Yeah, and I think folks in our community would have had some really valuable insights to share if only
Hmm.
they had been asked. There's the whole notion, right, of user expertise, right? The people who
Right.
live
That's right.
within systems understand them in ways even people who design them don't. So yeah, and I think belatedly folks are coming around to that. I mean, we are getting more and more requests to be on various, state or federal or, private business, advisory committees and whatnot. Um, and I think there's more attention is being paid to this, and not just with disability. There is the Health Equity Compact that's doing great
Yeah.
work statewide, trying to pass legislation that is there is some disability language in that bill, which we helped with, but it's primarily around um, racial justice issues in health. And I think there's a belated understanding there of the need to provide non-discriminatory care and to ask patients from marginalized communities what they actually think.
That's, well, I know you had one more you wanted to talk about. With one
Oh,
more.
yes. Yeah. So this one is S 1037. This is an act prohibiting discrimination against adults with disabilities in family and juvenile court proceedings. So this bill is really addressing a kind of longstanding injustice that's unfortunately been common in Massachusetts. And that is, just as we were talking about the presumptions about people with disabilities in healthcare. This is about presumptions about people with disabilities in parenting, specifically that
Mm,
disabled people are inherently less capable of being good parents.
I heard that.
And yeah, and Massachusetts is
Mm,
actually under a federal consent decree from the Department of Justice because of a history of discrimination against parents with intellectual disabilities. Um, but firstly, we still need state laws to cover those things. We can't rely on federal consent decrees, especially given that the federal government is not always consistent, depending on who's president on such issues. But also because that consent decree binds DCF, but it does not bind the courts. And we think that family law courts are a significant part of the issue where judges may hold incorrect, biased, stigmatizing beliefs about disability. And we've heard anecdotally all sorts of stories, deaf
mm,
parents being told, how will you know if you can't hear your baby cry? How will you know that's upset? Or, how can you change your baby if you're in a
mm.
wheelchair or whatnot? And so this bill it would simply state that a parent's disability cannot, in and of itself, be used as evidence of lack of fitness, right? If that disability uh, actually leads to specific, abuse or neglect or contributes to it, then sure, that can be taken into account.
Good.
Accommodations may be available, but that the court or DCF can't say you have this disability and therefore we are going to presume that you are an unfit parent,
Well,
without the need to actually show evidence. It's the kind of thing, it's amazing that we need a law, but unfortunately, this is the world that we live in, and this bill is definitely necessary. So that's still before the Judiciary Committee in the legislature, and we're hopeful that that'll move forward. So that's one. There's also, and I'll just speak briefly. I don't want to take up too much time, but there's one other one, which is H 1168 or S 726, which is an act protecting the homes of seniors and disabled people on Mass Health. This is estate recovery legislation. So in essence,
nope.
The under current law, when somebody dies, who if they were on Mass Health and they received long-term services and supports, things like personal care attendants or nursing home care, the state can seize assets from their estate, pay itself back for the costs of providing that care. Now, all states are actually required to do this to some extent by federal Medicaid law, but Massachusetts goes considerably farther than this. And there was actually just a great Blue Cross Blue Shield Foundation report that came out a few weeks ago, highlighting the extent to which this exacerbates income inequality, and holds poor families back, people with disabilities, and to the point where, disabled, parents who pass away sometimes cannot leave their family home to their children, unless it falls into certain hardship exceptions. So this bill would pare back estate recovery to that federal minimum. It would introduce additional hardship exceptions, and it would exempt people who are in common health, which is the state's program for working disabled people who pay to be on Medicaid because their incomes would otherwise be too high, from the program, because we don't think it makes any sense to say, yes, if we want you to work to buy in, to pay to be on Medicaid, and so you're able to work and do that, and then say, but you then can't leave those assets down, to your kids, right? You can't.
Oh, wow. That's ridiculous.
Yeah. So we're hopeful on that one too. So those are our big four bills this session. And if folks want more information on them, they can go to our website. It's dpcma.org. We have our legislative access agenda booklet up there. And then we'll actually be updating that in the next week or so with sort of information about where those bills stand presently, and updated bill numbers and such. But it's all up there on the website. Again, dpcma.org. And we would love folks to get involved. Also on our website, they can subscribe to our weekly newsletter, which has information on, significant goings on in the disability community, advocacy issues, but also community events, employment opportunities, surveys, things resources that we think the community ought to know about.
Wow. Well, I thank you very much, Colin. You've definitely said a lot of really good information and on bills that your organization and other advocates are advocating for. I hope that they do pass so they can improve the quality of life of people with disabilities, parents with disabilities, and I hope that continue that the lessons from the pandemic will heighten people's awareness about the quality of life of people with disabilities in their home. They're right. They want to live at home. They should live at home and get the quality health
Absolutely.
care they need.
Yeah.
Wow. Well, thank you very much for coming on my show. Your information is posted. And if anybody has any questions, they will contact you. So I thank Colin Killick, the Executive Director of the Disability Policy Consortium in Boston, Massachusetts, for coming on my show. Thank you. And
It's
good
been a
night,
pleasure.
everyone.
Thank you.
Thank you. And good night.